Hi class, this is Melissa Wilgruber, and I will be going over this PowerPoint presentation on therapeutic hypothermia protocol via the Arctic Sun machine. We will mainly be discussing the Arctic Sun machine and the basic functions of it. On this first slide, I included two pictures. The first picture on the left is an older model of the Arctic Sun machine, and the picture on the right is the newest model, the Arctic Sun Machine 5000. The main difference between these two models is that the newest model on the right includes a large touch screen that displays information available to the user, and we will go over the information that is displayed on the screen. This slide includes the Arctic Sun machine basics. First, you want to obtain the machine for a patient that will be receiving hypothermia protocol. You power on the machine by using the power button located in the rear of the machine. Next, you want to initiate the therapy, so you would select the treatment, which would either be hypothermia or normothermia. That's the two options to choose from. You confirm the hospital protocol either by entering the target temperature to reach within 6 hours, or by confirming the pre-programmed protocol that should match your hospital protocol. And then you want to begin therapy by touching the start button. It's a green rectangular button that says start. Some information about the machine. It is touchscreen, as I mentioned on the first slide. There's troubleshooting available on screen. It stores and operates hospital protocols for hypothermia and normothermia. The on-screen touchscreen displays patient temperature, water temperature, patient temperature trend indicator. It has patient data and graph available on the main screen, and there is audio and visible alarms on the screen. So an alarm will sound, and then when you look at the screen, you will be able to see what that alarm is also. And this picture is a picture that has the display screen and some information that is on the screen that I just discussed. This slide goes over the Arctic Sun machine and how to operate for the 3 different phases, which includes the induction phase, the maintenance phase, and the rewarming phase. The induction phase, you want to choose the treatment options as I mentioned previously. It would either be hypothermia or normothermia. Enter the goal temperature, if not already programmed in the machine. Confirm the duration settings to ensure target temperature is obtained within 6 hours of initiation of the cooling process. And you want to verify this against your hospital protocol. Even if it's already pre-programmed in the machine, you need to always verify it against your hospital protocol and make sure that it matches. Then you want to connect the pads and temperature probe and touch start to initiate therapy by touching that green rectangular button that says start. The maintenance phase is the phase that follows the induction phase, and it begins right after the patient reaches the goal temperature. You want to keep the patient at this target temperature with minimal variations. And most hospital protocols is to keep the patient in the maintenance phase for 12 to 24 hours from when the target temperature was reached. The third phase is the rewarming phase, and this occurs either 12 to 24 hours after the goal temperature was reached, where you will start to slowly rewarm your patient. To access this phase, you will need to press the stop button to change the mode, and then start the rewarming process. This may also be pre-programmed in the machine according to your hospital protocol. You want to initiate rewarming on the machine by choosing the program protocol that will happen automatically once selected, or by manually choosing the rate to rewarm the patient, but most likely it will be an automatic setting that you will choose and not manual, especially since it's very important to rewarm your patient at a slow rate. And it's usually about 0.3 degrees per hour. The Arctic Sun machine, and this is just going over two different scenarios when you would have to transport your patient on therapeutic hypothermia, and also going over the water reservoir. When transporting a patient on therapeutic hypothermia, which can be done, you want to empty the pads, so you would press empty pads on the touch screen to purge the water from the pads before detaching the pads from the machine. Then you would disconnect the pads from the machine by pinching, then push-pull, but leave the pads on the patient. If you do not empty pads and purge the water, when you disconnect, water will spill out from the pads and make a mess. So you definitely want to remember to always empty and purge your pads and then disconnect the pads from the machine. But the pads stay on the patient and go with the patient wherever they're being transported. When a patient returns from their tests, you would reconnect the pads and you would look at the cords and it's blue to blue and white to white. You would turn back on the machine and choose continue current patient and then hit start to restart the therapy. A little information about the water reservoir. You want to use sterile or distilled water only. The pads must be emptied and disconnected in order to fill the reservoir. In order to fill the reservoir, you want to select Fill Reservoir on the touch screen and then Start. You fill by putting the fill tube, which is located in the rear of the machine, in the sterile water or distilled water. When the machine and pads are filled completely, it will automatically stop. You want to put the fill tube back in the storage site, and the Arctic Sun machine initially, if it's the first time filling it, it takes about 4 liters of water to fill the entire machine. This is going over the Arctic gel pads that are used for the Arctic Sun machine, and there's a picture and it just shows you the 4 pads. So the 2 top pads are the 2 torso or back pads, and then 2 thigh pads. That's 1 kit, and each set may be used up to 5 days, 120 hours. So you want to leave on the set. They're very expensive and you don't want to be changing them out every day. Definitely use them for the duration as long as they're not punctured or anything. The pads come in 5 different sizes for patients weighing 16 to 100 plus kilos or 35 to 220 plus pounds. And they come in extra small, small, medium, and large. And then for bariatric patients, we have universal pads. So if the large pads are not covering enough surface area, then you can use a large universal pad, and it kind of goes over, it's like a rectangle pad that goes over your abdomen to cover more area on the body. The universal pads, as I said, are used for additional coverage for bariatric patients. The Arctic gel pads, 1 complete kit should allow for sufficient coverage, which includes approximately 40% of the body surface area. They contain thin hydrogel coating. The hydrogel is water-based, contains mild adhesive, which is best for the skin. This helps prevent skin breakdown and any skin lesions, irritation, rashes, and the hydrogel also absorbs moisture, which is also a plus for skin. While the pads are on, you must inspect the skin every 4 hours by just peeling back the pads and inspecting the skin and then documenting your skin assessment. And with the pads on, you are able to do many things with patients that you would normally do with them off. You put the defibrillator pads under the Arctic gel pads and you can defibrillate your patient. The EKG leads can go under them and you can continue to monitor your patient's EKGs or just regular rhythm strips. An X-ray can be done with the pads on, and you're able to perform MRIs, CAT scan, and cardiac cath labs. The pads are compatible with many machines, and the patients are able to travel and go about their normal day with the pads on. Thank you.